My name is Billy Smith. I grew up in Fayetteville, North Carolina. I joined the Army soon after graduating high school in 1984. I spent 6 years on active duty in the Army, and then after that I moved to Asheville, North Carolina so I could go trout fishing. I didn't know anybody up there, but that was one of the reasons I moved to Asheville, was just to go trout fishing. Soon after getting out of the Army, I decided I wanted to go into healthcare, and then after 2 years in Asheville, I transferred to East Carolina University, where I received a degree in exercise physiology in 1996. About that time, I started having an interest in medicine, and so I applied to medical school, and that year I was lucky enough to be accepted to East Carolina School of Medicine. After graduating residency in Greenville, I moved back to Fayetteville, North Carolina, where I grew up, and I stayed down there for about 4 years, spent time with my family down there, and then moved back to Greenville in 2010. Fayetteville was just too big of a city, and Greenville was the place I lived the longest as an adult, and I considered it home, and started a private practice in 2010. Greenville's a very busy town just because to me, it's the largest town east of 95. We have a large capture area of about 33 counties for the hospital. So we have patients that come from the Outer Banks. We have patients that come from the Virginia line, from all over. So they see this as a hub. And so it's a very, very busy area. And people who graduate from ECU School of Medicine and Brody School of Medicine now, a lot of people stay in the area. So there's a lot of camaraderie among the former graduates of the university. Being a rehabilitation specialist, one of our goals is to improve the people's qualities of life that they have, whether they have a disease process that affects them on a daily basis, or if it's a disease process such as a car wreck that they'll heal from. One of the benefits of my practice is because we do prescribe pain medicines, I follow up with patients about every 2 months, sometimes every month. So over the last 6 years, I've had patients that I've seen more frequently than even their primary care provider may see. And so we definitely develop relationships. It's interesting, every summer I get paid with green beans, watermelons, and oysters, and whatever else. People think that they just want to bring me to show that they're a good person, and hopefully because they think I'm a good person. Since moving to Greenville in 1993, I've always felt part of the community. It was soon after moving here that I started doing some volunteer activity with Pitt County Hospital, and just seeing how appreciative people were for the help that you provided them led me to do more and more volunteer activities. You know, I have a wife named Jennifer and a son named Carter. Carter's 9 years old, and he has some autism and ADHD. A lot of the organizations I give back to and volunteer for involve him, whether it's the Exceptional Baseball League that meet on Saturday morning, or the Rocking Horse Ranch, which is a therapeutic riding program. So over the last 10 years, I've definitely tried to give back to the community. It's pretty rewarding to be nominated, and I'm definitely grateful.